low-income women. We provide them with health education, support, and resources. Health reform and budgets are complex. So I'm going to be speaking as if I'm a congressperson opposed to these programs, speaking to a woman who stands to benefit from them. This is how the conversation might go. We are terribly sorry that you live in a state where health insurance companies don't include maternity coverage, except at a cost you cannot afford. Yes, health reform would include maternity in all insurance plans after 2014, so coverage would be affordable and equitable. And yes, the insurance companies can deny you coverage right now because you are pregnant or because you have previously had a C-section. Healthcare reform would ban that practice in 2014, but sorry. While cutting all these programs, we are also trying to repeal health reform. Just think of it. Insurance companies could do this to you forever. I know. Health reform is right now, this very minute, requiring employers to give women the time and space to breastfeed. And breastfeeding is the best form of nutrition. It reduces the cost for families and for our nation. And I understand health reform is giving women more choices in childbirth by finally giving freestanding birth centers and their licensed practitioners Medicaid reimbursement. And that certified nurse midwives can now receive equitable reimbursement for the cherished services that they provide. But we want to repeal it anyway. I know that childbirth is the leading reason for hospitalization, and that the fragmentation created by lack of health insurance and lack of access to health care, lack of access to evidence-based maternity care, contributes to escalating health care costs for both families and our nation. Even though health reform would help this dire situation, we're still going to try and repeal it. Also, I should mention, we're trying to cut programs like Head Start. Yes, I've heard that every dollar invested in Head Start brings $7 back to our nation, through our national economy, through increased earnings, employment, family stability, and decreased welfare dependency, crime costs, grade repetition, and special education. 7,000 children in Pennsylvania stand to lose educational opportunities, and that 1,000 staff would lose their jobs. While we are cutting these jobs, we're also looking to decrease access to WIC, a program that provides food to pregnant women, babies, and young children, and also teaches women about breastfeeding. But cuts to the Maternal Child Health Block Grant would be especially exciting. The most vulnerable among us, premature infants, would lose vital newborn screenings and more. Then I think what women have to say to these congresspeople. Budget cuts and blocking health reform will put the health of women and families in jeopardy. These cuts are short-sighted. They hide the long-term economic and social costs they will create in chronic health conditions, unreimbursed emergency care, maternal and infant complications and deaths, low educational achievements, and lost jobs during this fragile economic recovery. Invest in our families by protecting health reform and the programs that create a bridge to it in 2014.